Lean has helped Wilmington Health's operations by doing many, many things for the patients. With Lean, the patients are always at the forefront of our mind as we make process improvements to create as much value for the patients when they come to Wilmington Health. Lean provides patients with a tremendous benefit. It is an avenue for the patients to truly have a voice in their experience at Wilmington Health. We take to heart our patient satisfaction feedback and responses that we get. We engage patients where it makes sense as we are making process improvements to really truly get their opinion and make sure that the things that we are putting in place and the changes that we are making make sense for the patients and not just for the organization. Lean can benefit the patients in so many ways, and it's important and so valuable to us to receive their feedback. As this ties to the vision for Wilmington Health, as we look to reduce the cost of care for the system as a whole, improve the patient experience, and truly demonstrate quality for our patients, we use this systematic approach through Lean to meet all three of these objectives. It's an ongoing process. It's Wilmington Health's commitment to continuous improvement and knowing that change is inevitable, and every single day we're looking at what we do and how can we change it and make it better for the patients. It's really hard to narrow it down to just one. We're formally implementing Lean in several areas of Wilmington Health. We started in our OBGYN department, looking at the patient flow throughout that department, and have had some successes in getting the staff really bought into looking at the things that they do and how it relates to the physician and patient encounter and how to best support that and set up a system in that division that really truly sets up that value-added experience for our patients. And in particular, looking at paperwork that patients complete when they first arrive at the appointment and making those available online to get those things in motion before the patient even steps foot in the door to speed up the process once they get there to see their physician. We're working in urgent care and looking at what the total flow time is for patients when they come into the urgent care office and breaking that systematic approach down and again, eliminating as much of the useless steps in the process as we possibly can to get those patients who really are coming into urgent care because they just don't feel good back out the door and home to where they can get to feeling better more quickly. We've been doing work in the surgery department and looking at how can we turn around the exam rooms more quickly to better accommodate the patient flow throughout that department and working on various different steps in the process there. So there's lots of things going on informally as well in areas that have just heard about how process improvement can really help the patient experience throughout Wilmington Health of staff and providers really stepping up and looking at the way they do things differently and how can they make it better.